Hi everyone, it's Heather doing another video, and this time I'm going to be showing you what I plan to take to clinicals. Clinicals for me start in about a week and a half now. I'm very excited about that. I don't know yet which location I'm going to be at first. We have approximately 5 hospitals that I expect will be rotating through. I don't know how long we're going to be at each one. That's kind of not determined for sure, and we're not at each hospital for the same length of time. Sometimes we'll be at one place longer than another. But anyway, wanted to give you an idea of what I plan to take with me. This does not mean that I will actually use all of this stuff. I may not. I really don't know. I'm kind of one of those people who likes to be over prepared for things. So, as you can see, I'm wearing my scrubs. First of all, these are Cherokee Infinity. I also have a pair of Wonder Wink and a different top that's also Cherokee Infinity. I really like the Cherokee Infinity. I went and tried a few different on. I've never worn scrubs before, so this was new for me and I wanted to see what I would like. This has a stretch panel in the back, which makes this a really comfortable top to wear, and hopefully won't be too wrinkly. I think the Wonder Wink ones that I got seem like they're going to wrinkle a lot more, and the legs were much baggier and I didn't really care for that. But I'm keeping those as a backup set in case I need them. So that's first of all scrubs. Our program requires that we wear teal. They do not care what brand we buy. We don't have to get any specific one. Other programs are different. Same thing with shoes. Our program does not specify what kind of shoes or color or anything. We just need shoes that we're comfortable in. So I have a pair of ugly shoes. They are the Nike Air Zoom Pulse that just came out this month, last month, I don't remember, last month I think. They are hideous, but they are also really comfortable. I've worn them a few times just to try them and see how they feel, and yeah, they're ugly. They're kind of like neoprene, but I wanted something that was a sneaker style. I tried on some clog style shoes, other things that were recommended as being great shoes, and I just personally didn't like them. I wanted something that was more of a tennis shoe slash sneaker, however, whatever word you use. They use different words for those in different regions. But I didn't want something with laces just in case it got gross stuff on it. I wanted something that was going to be easy to wipe off. So that's the shoe that I went with. I don't know if they're available any longer. They were very limited and they sold out very quickly, like within 15 minutes quickly. But if you can get a pair, they are super, super comfortable as long as you don't mind them being ugly. I am also going to be wearing compression socks. I bought these off of Amazon. I bought like a 5-pack for something like $25 or $30. And again, I've tried these. They're comfortable. I'm a bigger person. They don't cut off my circulation or anything like that. They were comfy. I have read multiple places that for a job like this where you're going to be on your feet all day and walking around a lot, that compression socks can be a lifesaver. And I just figure I'm going to be proactive and wear them from the beginning. And if at some point I want to try not wearing them and see how that goes, then I will. Or if I find that I don't like them, but at least I have them if I need them. So that's it for clothing things. Now we're going to go on to other equipment. So I have a little issue with purple. A lot of my stuff you're going to see is purple. I really like purple. This is my stethoscope case. I've had this since before my program started. I have, and hit myself in the face, I have an MDF stethoscope, fairly cheap. Nothing fancy. I like the colors. That's kind of the reason that I got it, and I didn't feel like spending a ton of money on a stethoscope. It's a decent one as far as I can hear what I need to hear, but I'm not going to cry if I lose it or something like that because it costs too much money. It's not one of those. I think it was $45 or $55, something like that. And then in my stethoscope case, I've got a zipper pouch over here, and in that zipper pouch I have a pair of shears. This is something I've always had around my house. My ex was a paramedic, and so we always had medical shears like this, and they're really useful, and I figure it's not going to hurt to have a pair. I've got my little lapel watch. I talked about that in another video, that I don't really care for wearing a wristwatch, so I have a lapel watch that I will be able to wear. The other set of scrubs I have has like a little place where I can put something like that, or a badge reel, or but this will just get pinned somewhere. We'll see where it's most handy to me. I don't know yet. I've got extra earpieces for my stethoscope. I've got hair ties because I have long hair and it gets in my way, and I constantly am braiding it and just throwing it up out of my way, because there's no way that I'm going to keep long hair like this down around the hospital. A couple of alcohol prep pads, just because you never know what you might need. That is all that I have in my stethoscope case. I have also a little pocket calculator. I don't know if I will be taking this with me. I know that lots of RTs that I've talked to use their phone as their calculator. I don't know if I will be able to even have my phone in the hospital with me. One of the hospitals that we're going to be going to, we already had to sign a statement that we can't even bring our cell phone onto the premises. It has to stay in our car. So I have my little pocket calculator in case I'm going to need that while I'm out and about. I have my glasses. I don't wear glasses typically, but these are reading glasses. I don't know that I will actually ever really need them, but I figure I'm going to have them available to me just in case. The other couple of things that I'm going to have pens. I have my G2 Pilot pens that I absolutely love. I plan on having 3 of these on me at all times. I'm someone who tends to put pens down and walk away and leave them behind. So I want to have multiples. So a couple of things that I have, I don't know if I'm going to be using them. I don't know if they will end up being helpful, but I figure I may as well give it a try, right? So the first one is this little practical detailed quick for respiratory care. It's like a little pocket guide. It will actually fit in the pocket of my scrubs. My scrubs have multiple pockets. I have regular pockets in the pants. I've got one large cargo pocket on one side, one strap on the other side. The top has 1, 2, 3, 4, 6, 5 something pockets. So this will easily fit in one of those, and it has all sorts of information, from formulas to information about diseases and medications and all sorts of things. This was given to me by my very first respiratory care teacher that I had a year and a half ago, who's a super nice guy, and I still keep in touch with him. And he was going through his old books and things and getting rid of a bunch of stuff, and so he grabbed this for me and gave it to me when I saw him next. And then I also bought a white coat clipboard. This is the respiratory version. If you haven't heard of these are foldable clipboards, holds regular paper on the inside. I think I'm going to get lined paper to put. I just put this in just to show how it works. But so you put the paper in and it folds up, provides the, you don't want stuff that you're writing down about patients to be visible as you're walking around. So this closes. So I do have a pocket that's large enough to fit this in. I don't know how likely it is that I'm going to want this in a pocket, because it would have to go in my scrubs top, and I'm not sure if that's going to weight it down too much. It is metal, but it has multiple bits of information. That's going to be backwards for you guys, so you're going to be able to read it, but it has kind of some of the same information that's in this little guide, just less detailed, maybe a little bit easier to find some of the information and see it. It wasn't expensive. I think it was like $20. So again, one of those things, I don't know if I will end up using it, but I have it if I want it and need it. What else do I have? Lunch bag, again, purple. So I do plan on bringing lunch as often as I can make myself be organized beforehand and bring it with me, just to save money. That's something that I want to try and do. I'm not always going to manage it. I know that I'm not really great about meal prepping, but I am going to try. I've got something written down over here. That's why. Let me look. I think that's pretty much all that I plan on taking. I know that we're going to have some sort of a badge that we're going to need to wear. I don't know if that's going to be a lanyard or a clip-on, so I'm waiting. I haven't gotten like a badge reel or anything yet because I'm not sure what style of badge it's going to be, but I may be getting a badge reel once I find out how that badge is going to work and where we need to wear it and all of that. But so basically I just want to give you guys an idea of what I'm going to be taking with me to clinicals. That's pretty much it. I know that some hospitals don't really have space for you to bring anything. So it's possible that my lunch bag and everything, but maybe my stethoscope case will end up sitting in my car during the day while I'm at clinicals. But we will see. I will let you guys know. My first day, we actually have like an orientation day on January 13th. So technically that's our first day of school. We won't actually be in the hospital on that day. So I think my first real day of clinicals is going to be that Wednesday the 15th. So first day of lecture is going to be the 14th, and I will give you guys an update after my first day of clinicals and let you know how it goes. All right, bye.